I am Dr. Rahul Agarwal. I am a senior consultant physician and a diabetologist in Medicover Hospitals, Madhapur, High Tech City. Dear listeners, we all know that India is having one of the highest population in the world. Slowly, we are also realizing that the population of older people that we call as geriatric population is also increasing the rise. According to the 2011 census, about 8.6% of all Indians are geriatrics. Geriatrics encompasses people aged 60 and above. You know why geriatrics is becoming now the important topics? Because people are living longer, the life expectancy is higher, and we expect certain problems that we do not see in the adult population to be seen in the geriatric population. We all know that as you age, the chances of having hypertension, the chances of having diabetes, the chances of having other organ system failures is very common. That is a general knowledge to everybody. Today I am trying to speak about things that are called as specifically related to the geriatric population, called as geriatric syndromes. These are types of problems that are only and mostly faced by people who are older. These include delirium, these include dementia, these include also incontinence, vertigo and falls, and neglect. These are certain types of delirium syndromes that happens with old age, that is mostly seen with them. Not everybody will know what to do and when to handle such people, and then they will be at a loss. So I want all my listeners to understand that if there is an old person at your home, they are having certain population which they can't say. In fact, as they grow older, they have to be treated more like a child. Their liver, their kidneys, their lung function are almost like a child, very fragile. So fragility is also a geriatric syndrome in fact. What is dementia? Dementia is not only loss of memory, it is loss of other domains like retrieval of memory. If you say something to them, they can't really able to memorize things, they will not be able to do things properly that they used to do. Like if you say them that you go fetch this thing from that particular place, they won't even remember the thing that you told them. They would go to the wrong place and fetch a wrong object or something altogether different. They will forget that they have given some money to somebody. They will forget where their things are. They will be forgetting they have already taken a medication and take it again. Things of that sort. They will forget how to even say dress, how to even say go to the washroom when they need it. These are all problems that they are facing at that age, and that we have to know. Dementia can be something called as gradual, and sometimes it is very fast onset. So once it is gradual, we will usually find there are two types of dementia, that is called as Alzheimer's disease and Parkinson's disease. Parkinson's disease is more of a movement disorder, and dementia, that is lack of memory, is a late feature. In Parkinsonism, the first earliest feature is a movement disorder. There will be shaking of the hand and the trunk and the head, and slowly it will progress that they will not be able to move around. They will have a mask like face. They will be not able to speak in different volumes. The volume will be one simple speech, and also they will have a lot of problem doing their day-to-day work. Similarly, there will be Alzheimer's disease. Alzheimer's disease also starts as loss of memory. Their remote memory would be very good. If they ask that when they were born, what is their date of marriage, or certain life events that happened in the past, they might remember. But recent and immediate memories, that what did they do in the morning, what was today's date or day, they will be at a loss. That is why Alzheimer's disease has to be recognized very early and if possible treated properly. So this is about dementia. Then comes delirium. Delirium is a different syndrome in which even a small thing like a virus infection or a cough or cold or even anything lack of sleep or psychological stress, all this will cause the patient to have a lot of say psychological manifestation. Some people go into what is called as depression. They will not speak at all. They will apathetic delirium, we say, that they will not speak to anybody at all. They will be sitting at a quiet place, Some people will go berserk. They will all be shouting at their top of voice. They will be making all types of noises. They will be not eating things. They will be throwing out things. They will be even aggressive to the extent that they'll start abusively talking and beating around people. So delirium is actually a very reversible process. They can be identified, the cause can be identified, the precipitating factors can be identified and treated, and the patient might come back to his normal self as if nothing has happened. So delirium, that is going into depression or sudden agitation, is a very known fact in a patient with old age, and you have to remember that they have to be taken care of like a child again. Then comes depression. Depression is also a geriatric syndrome. You must have heard a lot of your, say, old people, friends and family talking that better to die than having such a life. Why am I living? I am a burden to the society. I am a useless person. All these depressions will be very common at the older age. You should also understand that depression is a treatable thing. To identify depression, there are certain scales that we use. To identify the suicidal tendency at that age, we are able to understand now. And to treat them properly is a challenge, as well as acceptable line of treatment is available. So it's no longer such a huge challenge as it used to be. There are safe medicines that can be given, and the patient will have a reasonably good quality of life. Somebody has said very nicely that there should be no years in life. There should be life in your years. So as long as you live in a happy, nice way. That is what is important. And then come one more important geriatric syndrome, that is vertigo and fall. Certain factors will cause vertigo and fall. Like if the patient is having very low blood pressures, heart problems and all that, they will suddenly, if they sit from a lying down position or stand from a sitting position, the sudden changes in the positions will cause them to have giddiness and they might fall. And this vertigo has got multiple causes, from the brain to cervical spondylosis to high or low blood pressures and sugars to ear problems to something called as autonomic dysneuropathy, meaning the body's mechanism, the automatic mechanism of the body to prevent us to fall will be very, very depressed in these patients. So once there is a vertigo, there is a high risk of falls. Problem with falls is that once they fall down, they are very high risk of having injuries. Even a minor fall, a slip and a fall can cause fractures, head injuries or external traumas, and once it comes, it is very difficult to heal. That leads us to why they fall. If there are restraints in their work, if they are not able to get up quickly, suppose they have an urge of going to the urine, but they are not able to reach that washroom, they will try to run as fast, they will fall. If the floor is slippery, they will fall. If the lighting is not good, they will fall. If there are no railing when they are falling to support themselves, they will fall. They haven't had good exercise, they haven't had good training of position, they will fall. And then if the sleepers are not good, if the the clothes that they wear are cumbersome, they will fall. There is certain reasons that people fall at this age. We have to address them very crucially and try to identify and try to maybe rectify. Similarly, having stairs here and there. Some people have stairs which are long and large and difficult to manage for even an adult normal person. For an elderly, it is very difficult. They will fall. They cannot judge the height of the stairs, they cannot judge the distance of the stairs, and then again the problem. Similarly, these falls leads to something called as osteoporotic fractures. This is another one more syndrome. Falling down for a normal adult is once difficult, and then if they fall, they normally don't sustain injuries. But as the person ages, the bones become weak, as if a chalk, meaning a little bit strain will cause it to break, and it is very difficult for them to come back again to normal. Doing a surgery for such patient, we see a lot of people with a hip fractures, which fracture of hands and legs, even with little trauma. Once the hip fracture is there, they have to be bedridden for so long, again sitting in the chair and couch for long hours, immobility will cause them problem. They cannot go for surgeries because there will be so many more problems that are there along with that fracture, like hypertension, heart disease, kidney failures. So they are very poor candidates for surgery itself. Identifying osteoporotic fracture is very important, as well as osteoporosis itself. By doing a simple thing called as a bone marrow examination, bone mineral density is more than enough. So once bone mineral density shows that they are osteoporotic, you can always have myriads of treatments that are safe enough to be given at an elderly so that the bone become more stronger. Similarly, weight bearing exercises, balancing exercises and endurance exercises are very important at this age. Then there is an important thing called as incontinence. The continence of urine, meaning if I have an urge to pass of a urine, I can control it voluntarily. But the aged people have that problem. Their prostates will be enlarged. The women will have problem with the pelvic floor muscles. Similarly, the external sphincter, that the valve that helps us to stop from urinating, will be very weak for them. And certain reasons, incontinence also, if the person is bed bound, if there is no way that he is getting up and going around, the urge to get up and go is not there, they will simply pass urine. Passing urine without any knowledge or passing urine without any hold of urination is very, very common. That happens with motions also in elderly. So that is one more thing that we have to be very, very aware of. And there are certain ways we can ask them to do certain exercises, like Kegel's exercises, of able to find out a way to strengthen the pelvic floors. Similarly, we can find out if there is an anatomic problem, like the pelvic floor can be maybe surgically made more healthy. Similarly, the prostate gland can be medically or surgically treated. Last but not the least is something called as neglect. They have been the master of their family. They have been taking care of everybody in the family. Suddenly one fine day they become retired, sit at home. Slowly they lose their importance. Slowly their monetary dependence comes over the children and their caregivers. Slowly their earning income is not so good, and they face something called as neglect. We slowly forget that the old people are there, that they have problems, that they have to be addressed, and then we just keep them at home without even bothering, asking even once, how are you? Once say hello, hi, is there a problem with you, or are you taking your medicine on time? They slowly find neglect. A lot of geriatric people, even in the best of economic population, face that neglect. The neglect could be either psychological or physical neglect. And abuse. They might be beaten up, psychologically shouted at, they might be harassed in a lot of different ways. So there are ways and means when we can identify a patient who has come to you with neglect and then tackle the problem accordingly. Today was a brief introduction on what the geriatric people face in our lives, and then what are specific problems that are there with older generations. So I hope this small maybe talk would help you realize that there is problem with the old age, and I hope and pray that you also come to a geriatrician who is also having expertise in this and take a medical advice. Hope you all live healthy and long. Hope you all understand that you will all be a geriatrician someday and geriatric population someday. God bless you. Take care.